Everybody put back in session. Okay, what do we have now?
Your Honor, just to clarify, because for the record, because I said I left one of the numbers out that Your Honor admitted, which was number 9, which is this photo of the abrasion to the leg. So I said 8, 11, 14, 40, 41, and 42, but for the record, number 9 was also admitted to those 7 photos.
Anything else?
Nothing else, Your Honor.
All right, let's bring them in. Let's get going. Right. Dr. D going to be the first witness today.
Yes, Your Honor.
Pardon me?
Yes, Your Honor.
Okay. All right, please be seated. I'm surprised to see that we still have smiling faces. Good morning, everybody. Good morning. All right, we're going to call the roll and get started. All right. All right, everybody's here. Next, state's next witness.
Dr. Feng Li.
And Mr. Hopkins, you will stipulate that Dr. Lee is a very well-qualified expert.
Do you swear to tell the truth, so help you God?
Yes, I do.
Dr. Li, go ahead and state and spell your first and last name.
Fengli.
And what do you do for a living?
I'm a forensic pathologist, and now is a chief medical examiner for Metropolitan Nashville and Davidson County.
What does a forensic pathologist do?
Forensic pathologist is one of the subspecialties in pathology. In general, there are 2 broad categories in pathology. One is called anatomic, one is called clinical. Anatomic pathology, probably people will know that, for example, in the surgery, the surgeon cut off a tumor and pathologist will make a diagnosis whether it's benign or malignant. Clinical pathologist is in charge for like clinical labs like chemistry, microbiology, blood bank stuff. And forensic pathology is one of the anatomic pathology.
And what does a forensic pathologist do in the day-to-day work?
Forensic pathology is in charge for medical legal death investigation to determine the cause and manner of death for those cases involving unusual, traumatic, violent deaths.
And Dr. Lee, your expertise has already been stipulated too, but I do want to just let you tell us just a little bit, a brief about your background. How long have you been a forensic pathologist, and what is your educational background?
Right. I had my medical degree from China, and I had also a PhD degree from University of Louisville in Louisville, Kentucky. Also a law degree from National School of Law, and I'm licensed to practice medicine and the law. And I had my residency training in Medical College of Pennsylvania and Hahnemann University in Philadelphia, and my fellowship training in forensic pathology also in Philadelphia.
And as a part of your job, do you perform autopsies?
Yes.
What is an autopsy?
Autopsy is a procedure or procedures, including several procedures. Basically, look outside. It's called external examination. And to document any trauma, disease, characteristic changes, clothing, stuff. And then open the internal cavities, including the brain, chest cavity, and abdominal cavity, to examine all the internal organs, mainly, including the brain, heart, lungs, and abdominal organs, to check for disease, for trauma, for any changes.
Dr. Lee, when you perform an autopsy, do you document your findings?
Yes.
How do you document your findings?
There are, it varies from doctor to doctor, but my, findings usually we document it when we do the autopsy, and then dictate it afterwards.
Okay. But then you produce a report?
Yes.
And is there a particular case number with your office that's associated with each report?
Yes, every case through our office, we will assign a specific number called a medical examiner number, and all the information will be related to the number will follow on the report.
Did you perform an autopsy on Joanna Ortega in this case?
Yes, I did.
Did you prepare a report?
I did, yes.
I'm going to pass you a document. If you could just look at the cover of this document and tell me if you're familiar with it. Over.
Yes, this is a copy of the report, including the toxicology report.
And, Your Honor, I'm going to ask to publish the cover of this autopsy report for the jury.
All right. You gonna ask to be admitted first?
Yes, Your Honor. I guess, well, after I publish it, I'll have it admitted as an exhibit. Is this the cover of the autopsy report that you performed on Joanna Ortega?
Yes,
And you've already talked a little bit about, your case number. Is this case number here associated uniquely with Joanna Ortega's?
right. MEC 17-2102.
And I want to ask you about this here. It says it has a date and time of death listed. Can you explain what that means and how that's calculated?
The date and time of death is the time when the victim was, officially pronounced.
So does that mean that Joanna necessarily died at 9:55 p.m.?
Right, that time was the time we used for official documentation, officially pronounced.
And why would that be different than possibly when she at the time she actually died?
Right, so for some scenario, for example, a decomposed body, when we discover that body, we will pronounce that as the official time of death. And we know that the person was not dead at the time.
You've already talked about, when you were explaining what you do, about cause of death and manner of death. Explain the difference to the jury about what cause of death means and what manner of death means.
Right. Cause of death is basically a disease or injury or trauma leading to the victim's eventual death. For example, the heart disease, lung disease, gunshot wound, stab wound, these are the cause of death. Manner of death in the state of Tennessee, there are 5 categories. One is called a natural death, meaning the person died as a result of natural disease. A complete natural disease cannot be anything else. For example, as I just mentioned, heart disease, cancer. Second category is called accident, meaning person died as a result of accident, for example, motor vehicle accident, accidental car accident. Third category is a homicide, meaning that person is killed by another person. Fourth category is called a suicide. The person killed himself, whether it's gunshot wound, hanging, and other overdose stuff. And the fifth category is called undetermined, meaning after we do the investigation, seeing, interview, autopsy, toxicology, all the tests, we still cannot come up with how the person died, or more than one possibility. Then we'll say this is undetermined.
And in the case of your autopsy of Joanna Ortega, what did you determine the manner of death was?
The manner of death is homicide,
And what did you determine the cause of death was?
strangulation.
What is strangulation?
So strangulation is one of the categories under asphyxia. In terms of the mechanism of asphyxia, there are generally 3 categories. One is called a suffocation. Asphyxiation is, in general, is inadequate oxygenation of the tissue. The brain, the heart do not have enough oxygen supply. And under the asphyxiation, there are 3 general categories. One is called a suffocation, meaning there's no oxygen lead or enter into the bloodstream. Second category is strangulation, hanging, and third category is called the chemical asphyxia. Basically, the body cannot use the oxygen. In terms of strangulation, it is a mechanism described as if we use pressure in the neck to either block the vein, then therefore to block the blood return from the brain to the heart, or block the blood supply of the artery. Therefore, there's no blood supply to the brain. So these are the major mechanism. The third is more force used to block the whole airway, trachea, and to block the air reach into the lung. So in the strangulation, when the pressure is used or applied to the neck, the small amount of force is used to block the vein. Next is more pressure applied to block the artery. Even more force is used to block the airway. So this, in terms of perspective, we use the rule of thumb. For example, you would say 4 to 5 pounds to block the vein, 10 to 11 pounds to block the artery, 20 pounds also to block the airways.
If a person is strangled, can you estimate how long it would take for the strength of the pressure to be on before someone unconscious?
Right. So first of all, there's a mechanism why people die as a result of asphyxia. So the brain is in need for constant supply of the blood with oxygen, with the nutrition, because it has very little reserve. If the brain is lack of oxygen supply for a very short period of time, for example, 10 to 15 seconds, the brain will not function well and the person will become unconscious. After a few minutes, usually it depends on the health and other factors, the few minutes, then the brain, if is complete lack of oxygen supply, then it will become or suffer irreversible damage. Basically meaning from that point on, there's no return. Either vegetative state or the person die. So a few minutes will make the brain suffer.
So that pressure has to maintain for at least a few minutes for the person to get to that point of no return.
Yes. Date of time, August 11, 2017 at the 9:30 a.m.
You're going to somehow pass this autopsy report up and ask that the next exhibit.
All right, I believe that chronologically is 68.
And I have, Your Honor, some digital slides which contain cut out pieces of this report that's already been admitted and some photos.
All right.
And I'd ask that that be published to the jury now.
All right, and I believe we specified for the record that the toxicology report is part of the autopsy, but it's not prepared by Dr. Lee.
Yes, Your Honor, thank you. And Dr. Lee, I'm going to pass you a few photographs that are going to be the photos that are in this presentation, but I'd like you to just look at the hard copies for one moment and tell me if these are photographs from your autopsy. Are those 7 photos that you took during your autopsy?
Yes, as a routine procedure, we will process the patient or victim, and one of the procedures is to take a photograph, and with the case number on that.
And I've just shown you 7 photos. How many photos did you take in total in your autopsy?
It varies from case to case. Some will have more, some will have less.
But this is not anywhere close to the total number of pictures you took, right?
Right. This is very few representative photos.
I don't think we got this, but what was the height and weight of Joanna Ortega?
Right. As a routine procedure, again, we will measure the height and weigh the body. And the height is 60 inches and weight 123 pounds.
You're seeking to publish now parts of the report and then those 7 photographs, which Dr. Lee has testified to in digital format. Dr. Lee, if you look at your screen, this evidence of injury, is that a section in your autopsy report?
Yes.
For the purposes of your testimony, I've underlined one part of the first part of your evidence of injury. Can you explain what that part is and what those injuries are?
Right. So the injuries usually categorized in several big categories. One is called the blunt force injuries. One is called sharp force injuries and other injuries. In this section, the first paragraph describes multiple contusions. Contusions are one of the blunt force injuries. Basically, for layperson, it's like bruises. So, multiple contusions on the forehead, left forehead, ear, right ear, and behind the right ear, around the left ankle, and abrasions. Abrasions is another trauma related to the blunt force injuries, meaning the skin scrape.
I'm going to show you a couple of photos now. What is this photo documentary?
So this is like an abrasion, like the skin scraped.
And where is this abrasion?
It's below the left knee.
Okay, in the next photo. What is this photo documenting?
Right. This is also a representative of. Right now on the one before. Actually, when I was describing.
Go back?
Yeah.
Okay.
The one before, when you look at the left knee, and there's another one on the right ankle area on the top. Can you see it? This is abrasion also. So next. This is on the right ankle area, you see the abrasion.
And would you be able to say if this abrasion appears to be fresh to you or old?
Right. It's fresh.
Okay. In the next photo, what is this? Can you describe this photo?
So this is another abrasion. See, abrasion is basically skin scrape.
And where is this abrasion?
This is more like on the one I just described, the white back on the top of the part.
And is this one fresh or old?
Yes, fresh.
And yeah, go ahead. And this one, can you say where this one is and what you can say about
These
it?
are more like healing. It's not necessarily fresh.
The fresh abrasions on the victim's leg that you just testified to, could those be consistent with her her leg striking a metal bed rail?
Right. Basically, what we say, blunt force injuries, whether it's a hit or by some blunt object, or the skin was against some rough surface. So these are consistent with the metal object.
Okay, we'll go to the next slide. This is underlining another section in your report. Explain what this is talking about.
First of all, these are the description for petechial hemorrhages. Petechial hemorrhages are characteristic changes when somebody strangle or apply the force in the neck. The mechanism basically is like this. There are blood supply to the brain and blood returning from the brain to the heart. So if the blood supply is continuous, but returning is blocked, the veins are blocked, the blood will be accumulated above the neck. So the pressure is built up and it has to find somewhere to go. Therefore, a lot of small bleedings everywhere in a very thin area, most time around the eyes, eyelids, and eye whites, the conjunctiva, that's called, or oral mucosa, basically inside of your lips or inside of your mouth. These are the petechial hemorrhages, and as a result of the pressure applied to the neck.
And the fact that the victim has, or that Joanna Ortega has so many petechial hemorrhages, what does that tell you about the type of occlusion in terms of the blood in her neck?
That is, as I described, apply the pressure hard enough to block the venous return. And in terms of the hanging, especially the hard hanging, when the ligature is so tight, you will block the whole blood supply to the brain. So there's no blood supply, therefore there's no block of the venous returning. Usually you don't see petechial hemorrhages. But here, it is more like blood supply to the brain is still going on, but returning of the blood is not as normal. So the blood will build up, the pressure will build up, and the petechial hemorrhages everywhere.
And I know you've said some of them, but can you please just list where all you saw the petechial hemorrhages on Joanna Ortega?
On the forehead, eyelids, cheeks, nasal bridge, meaning on the nose, chin, inferior periorbital conjunctiva, meaning inside of the eye, oral mucosa, as I just described, right side of the back also.
In your experience, can you say anything about whether or not this, in terms of the extent of the hemorrhages, is a little or a lot, or how extensive are they?
They are a lot.
The next thing here is bilateral periorbital bruises. What are those?
Basically, periorbital meaning around the eyes. Bruises meaning, orbital bruises, the bruises around the eyes.
And bilateral means both eyes,
Both
right?
eyes, yes.
So bruising around both eyes.
Around both eyes, yes.
And then the last part of this section is the hemorrhages, the conjunctival hemorrhages. Explain that.
Basically, the eye white area are hemorrhagic or bleeding.
Is that characteristic of strangulation?
It's like a severe, severe application of the force to the neck, and the blood vessels bursted and bleeding.
And we'll just go to the next slide and show you, what is this picture documenting?
So this picture, you can see these small red dots on the eyelids, on the cheek. See the very small, tiny red-ish? These are called petechial hemorrhages.
And what about, do you see any bruising around her eyes that you also talked about?
See, these are the bruise area.
Go ahead and circle the bruise area right here.
Yeah, that's called a periorbital bruise. Periorbital meaning around the eye.
And she had that on both eyes.
Yes.
We'll go to the next photo. What is this showing?
This is a contusion, meaning the blunt force or bruise. Yeah.
Go to the next slide. This part of your report has to do with the pattern abrasions. Explain what you've documented here and then describe those injuries.
Pattern abrasion or pattern trauma, meaning this lesion or trauma or injury has some pattern to it. For example, here is a recognizable rectangular shape, meaning there's a square shape, and other abrasions on the right cheek.
We'll go to the next slide. And I know you can't, this isn't the best view of it, but can you see that a part of that rectangular right angle pattern injury you described?
There's one rectangular, usually you have more than like an angle, but there's only one linear thing here.
But if this picture could show more of the face, what would you see?
Right, you will see it's, for example, like this.
That rectangular linear abrasion, could that be consistent with her, with Joanna's face striking a hard rectangular end of a dresser?
Yes, that's consistent.
The pattern abrasions, we don't have a good picture of it, but could the pattern abrasions that you noted, where were those? The one on her face and where else?
On the cheek, that part above, close to the nose area, on the right cheek.
Could those pattern abrasions be consistent with a shoe tread?
Yes, if you have some specific pattern to compare, then you can say, yes, consistent with something.
Could they be consistent with being stomped on by a shoe?
Possible, yes.
Could they be consistent with having her face pressed up against a shoe?
Yes.
We'll go to the next one. What is this section?
So this section described on the neck, basically meaning there are abrasions on the neck and where they are located, and described as a ligature marks.
What are ligature marks?
Ligature marks basically describe as the ligature, for example, belt, shoelace, these ligature, when they apply to the neck, there will be some impressions or abrasions or injuries left behind on the neck. So that's called the marks, ligature marks.
Can you learn anything from the tightness of the ligature marks and also the presence of petechiae? Can you learn anything from that in this case?
It depends on the fuse of what we describe as the ligature mark, how deep it is to the neck, to the skin. And sometimes we can say consistent with something, otherwise other times we cannot say. All depends on several factors. For example, the scene investigation, autopsy findings, and so on.
The next part of your report is documenting something called subgaleal hemorrhage. What is that?
So subgaleal hemorrhage is, first of all, the galea denotes to the skin on the top of the head. That's called the scalp. Subgaleal basically meaning some bleeding underneath the skin of the head. And this is also a result of blunt force injuries.
And then the part that's not underlined here, but the next thing has to do with the injury you noted to the tongue. Describe that.
The tongue, when we examine the tongue to see if there are trauma, basically it means the tongue was bitten or there are some contusion or bruise on the tongue.
Is the subgaleal hemorrhage consistent with a blunt force injury to the head?
Yes.
And you did not note a skull fracture, is that right?
No.
Do you have to have a skull fracture to have a blunt force injury to the head?
It depends on the force used. If it is forced strong enough, then not only cause the subgaleal hemorrhage, but also skull fractures. If skull is a tough bone to resist some forces.
Explain what a dusky brain is.
Dusky brain is a non-specific finding, just meaning probably the brain is lack of oxygen, hypoxic event, and so on. And it is not just to be associated with strangulation, sometimes also with drug overdose.
We'll go to the next slide. What is this part documenting?
So after we did an external examination, I described the bruises, the blunt force injuries, strangulation, the marks on the neck. Then we do internal examination to see what also other things injured. We will remove all the organs and then drain a little bit, and then we would do this called the layered forensic neck dissection. Basically, layer by layer, like soft tissue, muscle, layer by layer, to see if there are any soft tissue hemorrhage, muscle hemorrhage, bone fracture, and so on.
What did you learn from the hemorrhage in the neck?
So basically, there are multiple areas of soft tissue and muscle hemorrhage associated when I did a later forensic neck dissection. And no apparent palpable neck bone fractures, especially higher bone and some thyroid cartilage. I didn't see that fractures.
And do you have to have a fracture in order to die from strangulation in the neck?
Fracture?
Right.
No. You don't need to have a fracture to make a diagnosis.
Okay, and we'll go to the next slide. What is this slide telling you?
The underline I've already described.
Right here. I want to point you to the third to last paragraph here that starts with a sexual assault kit was performed. Can you explain what that is?
As a standard procedure for some homicide involving potential rape or sexual assault, we will do the sexual assault kit. Basically, we'll swab the areas, including the mouth, including the vagina, including the anus, and other potential areas for possible, like I say, DNA sources.
And when you do those swabs, what do you do with the swabs?
Then we'll submit it for DNA examination.
Did you note any trauma to the victim's genital area?
I didn't see apparent.
Does the absence of trauma to the genital area exclude penetration?
No.
You already mentioned that you package up the swabs and send them to property. Do you also do that with some other items and stuff like that when you perform your autopsy?
Right. We collect the evidence, including all the evidence for examination, clothing articles. If there's other evidence, we will submit it for evaluation.
I'm going to pass you a group of exhibits here, and if you could just go through these and describe if you recognize them.
So we have several envelopes. One is called a blood spot. We have this case number associated. So I will recognize, as I described, all the evidence, all the material will be associated with this case number. Case number is MEC number 17-2102. For example, blood spot, hair from the head, hair tie, ace wrap, panties, pants, and these are the envelopes.
Do all those have your unique case number on them?
Yes, every envelope has the unique case number.
Okay, if you could pass those back to me. I'm going to pass three more up to you. These would all be items that you collected from Joanna's body when you did the autopsy.
Right.
And what are these three?
So this also has the case number. The big envelope is the bra. This is shirt. And this is a pad.
At this time, I'm going to ask that these all be admitted, and I'll read off one at a time for each exhibit. We'll ask that all of these be these will all be a collective exhibit, and I'll read them off so we can know which one is which in what order.
Using A, B, C, D, etc.
And what exhibit are we on?
69.
Your Honor, 69A will be the hair sample from the head from the medical examiner. 69B will be the blood spot. 69C will be the hair tie. 69D will be the pad that was collected. F will be the bra. G will be the shirt. H will be the pants. I will be the panties. And J will be the ace wrap. Your Honor, the state also seeks to introduce this digital presentation with the report and the photos as the next exhibit, which would be 70. We will have to prepare that on a disc since we were editing it this morning based on our hearing. And those are all my questions.
All right, Cross. Yes, Your Honor.
Dr. Lee, when you examine a body like this, is there any way to tell which of the particular abrasions occurred first?
If they are close enough, I cannot.
And what do you mean by close enough?
At the same time, or very short period of time. If the person is already dead, then some other injuries occur, then I can tell the difference. Because if the person is already dead, there's no reaction. Otherwise, if they are very close in time, I cannot tell the difference.
If the injuries, for example, had occurred over the period of a 30-minute or 1-hour period, would you be able to tell a difference in those?
No.
What's the time frame you would need to know that an injury has begun to heal, therefore you can maybe date it compared to fresh injuries?
That varies from person to person. There's no set formula, and depends on the other factors.
So in regards to the strangulation and the other injuries, is there any way to tell which of those occurred first in this case?
Probably not.
So it's possible then that the other injuries occurred and she was strangled last, or could she have been strangled, struggling, injuries occurred during, after? Is there really any way to date any of those or timing of those in this case?
Right. Probably during the struggle and probably during the, strangulation, but probably not after she is already dead. If she's already dead, then these injuries cannot initiate any reaction or bleeding or so on.
So whether or not she moved about that room where she was found in its entirety, there's no way scientifically to know that based on an autopsy.
Right.
You didn't find any evidence in this case consistent with any sort of sexual assault, is that right?
No, I can only describe there are no apparent injuries to the genital area, but I cannot say there's no associated sexual activity also.
So I'm sorry, there was associated sexual activity or there was not?
No, I cannot say what was or was not.
Okay, so it's inconclusive.
Right.
Generally in an autopsy like this, can you tell if someone has been sexually active?
There's no general category. It varies from case to case.
The state's asked you a couple of questions about whether specific injuries were consistent with striking a particular object. Do you recall those questions?
Yes.
Can you say to any scientific certainty that that was the cause of that injury? Perhaps, I think they used a dresser edge. Do you know if that was the source of the injury in this case?
Right. I can only say this is consistent with, but I cannot say this is caused by the object.
So whether she struck the dresser in this case or the bed frame, that's something that you just can't determine based on the science you use.
Exactly.
Regarding the shoe tread that was testified about, can you say to a scientific certainty that it was in fact shoe tread that was on her face, or could it have been another impression object?
Right. So I have to say if you find the shoe, then you can compare. Otherwise, I don't know. I can only say if you give me the scenario, I'll say this is consistent maybe to the shoe or maybe to the other objects with the specific pattern.
So it's not like television where you can have a CSI show and know exactly the cause of certain things.
Usually we will compare the object to the injury. I cannot just use the injury to predict.
And in this case, you were not asked to compare a particular shoe print
No,
with those injuries.
no.
that that is just an official time that has to be given that's required by law.
Yes.
And the actual minute or even hour that Ms. Ortega died, can you tell that from your autopsy?
No.
Can you give any kind of range of time?
Yes.
What would be the range of time?
Usually the range of time is broad. Depends on when the victim was last known alive to the time when she was found dead. So this is the range or window of time. And sometimes we can say close to this point or the other point. It varies so much, we cannot use exact time.
So the time you put down was 9, a little after, well, close to 10 p.m.
Right.
Is that correct?
Exactly.
Do you know how long before 10 p.m. she actually died?
No, again, we will say this is the window of time, and the official time of death is when we officially pronounce the patient dead.
Right, I understand that, but I guess my question is, if the official time of death, which is just, it's a legal fiction.
Yes,
It's not a real time of death.
right, exactly.
But from...
It depends on the situation. Sometimes, the patient that died in the hospital, they witness the patient die right then, right there. They can say this is the time. And other things, if it's not witnessed, then you don't have the exact time of death.
Right, but in this situation, where there is no, she didn't expire in the hospital, for example.
Right.
If your official time of death is at 10, can you say, for example, she was deceased at 3 p.m.?
No,
Could you say she was deceased at 5 p.m.?
no,
Could you say she was deceased at 4:30?
no.
Could you say she was deceased the day before?
See, again, that's the window is already set. She was last known alive.
Right. I'm asking from a scientific standpoint in an autopsy. Surely she wasn't dead for 24 hours before you examined her.
Right, but then when you give me the example, I know in this case cannot be the day before.
But as far as a specific time of 3, 4, 5, 6 p.m. of that same evening,
Right, scientifically we're not there yet. We cannot pinpoint which hour or which minute.
would there be anything about the environmental conditions of where she was found that would speed up or slow down the process to help you date that?
Yes, again, there are so many other factors will affect what we call the postmortem changes. One of the factors is the ambient temperature, the room temperature. It varies from, say, outside right now to outside in the winter. So they make a difference.
And even if you knew that in this case, it still would be difficult, if not impossible, to give a specific time of death.
Exactly.
That's all.
All right. Redirect.
No redirect.
Dr. Lee, thank you. You're excused. Next witness.
Your Honor, at this time, we would seek to publish exhibit number 4, which would be the 911 call, which was authenticated voices by Patricia Velasquez and Jocelyn Ortega.
All right.
And I believe the court has that disc.
Today, August 10, 2017, 18:45 and 23 seconds.
911, what is the address of your emergency?
Hi. My sister, we just got home. She went home alone. They killed my sister. I don't know what to do.
Hey, take a deep breath, okay? What's your address?
1229 Old Ligature Marks.
Repeat your address for verification.
1229 Old Ligature Road.
Okay, is that a house, apartment, duplex? what's the phone number you're calling from?
605-240-808.
And your name? Ma'am. What is going on? I can't understand what you're saying. Are you speaking another language?
Okay, can you come? The address is 1229 on Ligature.
Okay. I've got the address. I need to know exactly what happened.
I got to borrow my girl's house for a job. She's here in the...
I can't understand.
Okay, somebody speak Spanish? Somebody speak Spanish?
Hold on. Stay on the line with me, okay? We're going to get somebody to speak Spanish.
Please select the language you need, or you selected Spanish. You will be connected to the next available interpreter.
Hello, my name is Angelica, Spanish interpreter, 1112.
Okay, so you just tell me exactly what happened.
Bueno, señora, habla un Señora, dígame exactamente qué es lo que pasó. Mi niña tiene usted. Yo salí a trabajar a las 12:30. Claro que aquí en la traila estaba asegurada. Alguien entró a la traila ahorita llegué y mi niña está marcada. Mi niña le tienen una cinta, la violaron a mi niña. Oh my God. So my daughter is 12 years old. I went to work at 12:30. I left her here at the trailer, and it seems like somebody came into the trailer, broke in, they choked her, and it seems like they raped her. Okay.
All right. Stay on the line with me, okay? And we're going to get in. I want to go get this. How did this happen?
Manténgase en línea conmigo. ¿Me puedes decir como hace cuánto tiempo que esto ocurrió? No sé. Yo me salí a las 12:30, a las 12:30. Regresé ahorita. Mi niña estaba aquí. Y le traté de quitar la cinta del cuello, pero yo no quiero que a mi niña la violaron. Permítame, por favor. I don't know. I left at 12:30. I'm just coming back now. I actually just tried to remove like a rope or like a shoe, something that was around her neck, and they raped her.
Okay. Does your is your daughter awake?
No está despierta. ¿Está despierta? No. Traté de quitarle la cinta, pero yo me la mataron. Le quitó la cinta, ¿qué hago? Le toqué la cinta, pero ya tiene sangre y ella no respira.
Okay.
Hasta abajo, mi niña.
How old? Okay, we're going to get help out to you, ma'am. Is your daughter awake?
No tiene sangre. Mi niña está llena de sangre sobre ella. Señora, por favor, un momentito. She was not breathing.
Okay. All right. Stay on the line with me, okay?
Manténgase en línea con nosotros, señora.
Okay. Stay on the line, okay? I'm sending you to help you now. Stay on the line. I'll tell you exactly what to do next. Listen, anything around the neck and tell me if she's breathing.
Los paramédicos, escúcheme, están enviando los paramédicos ahora mismo para que le vayan a ayudar a su hija. Les voy a decir exactamente qué hacer. Si ella tiene algo alrededor del cuello, por favor quíteselo o hágalo más flojo. Hay manera que usted me pueda decir si ella está respirando. Ok. ¿Qué no? No, ella está fría ya. Ella está fría. No, she's not. She's cold. escúchame por favor.
Okay, if the defibrillator is available, send someone to get it now in case we need it later, and tell me when you have it.
Bueno, mira, usted tiene un desfibrilador, vaya por él en el dado caso de que lo necesitemos más tarde. Si lo tiene, vaya por él y me avisa cuando ya lo tenga en la mano. No sé qué es eso. I don't know what that is.
Okay, that's fine. Listen carefully. Are you right by her now?
Bueno, está bien, señora, pero escúcheme atentamente. ¿Usted se encuentra junto de ella ahora?
Sí, sí, sí. Listen carefully. Lay her flat on her back on the floor and remove any pillows.
Bueno, señora, va a hacer lo siguiente, por favor. La va a acostar plana, boca arriba, en el piso, y le va a quitar con el tiempo para su alrededor, especialmente ella está llena de sangre, ella está llena de sangre. En su boca, en sus orejas. En her mouth and her ears.
There's what?
Her mouth and ears are full of blood.
Okay. All right. Dan, okay. Do you think she's beyond any help?
Okay, so I'm trying to give her my breath through her mouth.
Okay, all right. Then clean out her mouth and nose. Okay, get a clean, dry cloth towel and clean out her mouth and nose.
Bueno, está bien, señora. Le va a limpiar la nariz y la boca. Consiga una toalla limpia y le va a limpiar la nariz y la boca. Ok, ya se lo limpié.
Okay, I'm going to tell you how to get mouth to mouth, okay? Place your hand on her forehead, your other hand under her neck, then tilt the head back. I want you to pinch her nose closed and completely cover her mouth with your mouth, then blow 2 regular breaths into the lungs, about 1 second each. The chest should rise with each breath.
Bueno, señora, entonces yo le diré cómo le puede dar la respiración de boca a boca. Va a poner una de sus manos en la frente y la otra mano en el cuello. Va a inclinar un poco hacia atrás la cabeza y le va a cerrar la nariz con sus dedos. Después va a cubrir la boca. Después de eso, le va a cubrir la boca de ella con la suya y va a dar 2 respiraciones normales, separándonos como 1 segundo. El pecho de ella debería de subir. Quítale. ¿Usted pudo sentir que el aire entró y salió? Ya. ¿Y pudo sentir que el aire entrara y saliera? Sí, sí, sí.
Okay, listen carefully. I'm going to tell you how to do this compression. Make sure she is flat on her back on the floor. Place the heel of your hand on the breastbone in the center of the chest, right between the nipples, and put your other hand on top of that hand.
Bueno, señora, entonces yo también, escúchame por favor, le voy a...
Okay, I'll let you do the real longer. Goodbye, ma'am.
Bueno, hable con los especialistas.
Are they right, Rosa?
Ya me lo con tu hija. Excuse with you, or they are not getting responsible. Okay, somebody's here. Thank you.
Are they there with you?
Thank you. Ya, no, sigo working, pero sí. Ya está, señora, escúcheme, ya está con usted.
Okay.
Okay, thank you, Lord. Lord, ayúdame, por favor. Okay, gracias, señorita. Stay on key, okay?
Thank you, ma'am. Thank you, thank you for, assisting.
All right, we're gonna go ahead and take our morning break, and then we'll come back and finish up. All rise.